Welcome back to AM Northwest. Doctors say it's the #1 cause of heart attacks in women under 50. Here to share her very personal story and what we're going to find out, we welcome heart patient Tracy Lindstrom along with Providence Heart Institute cardiologist Lori Tam. Good to have you both with us. Nice. Let me start with you though, Tracy. Tell me your story.
Well, it was a little over a year ago. I was playing with my nephew at my mom's house, and all of a sudden I got this shooting pain in my heart, and it felt like my heart was on fire. And then it kind of radiated all the way down my left arm. And I knew something was very wrong, just didn't know really what was going on, but my mother rushed me to Providence St. Vincent emergency room.
Wow. And Dr. Lamb, what was happening?
Well, she was having a heart attack from spontaneous coronary artery dissection, also known as SCAD. It's the number one reason for a heart attack in women under 50. And SCAD is due to not a typical cholesterol blockage, but it's due to a tear in one of the blood vessels that feed the heart. This causes blood to pool and a clot forms. In her case, she actually had the widowmaker. It involved the left main coronary artery, and this blood vessel is very important because it feeds the majority of the blood flow feeding the heart. When patients have a blockage in this artery, it can result in a massive heart attack or sudden death.
Wow. Explain to me, Dr. Tam, what SCAD is.
Yeah. So essentially, it's a tear inside the blood vessel, within the lining of the blood vessel, and that causes a clot to form, which then cuts off blood flow, and it really looks and is a heart attack. It's just not one due to cholesterol blockage.
And now also, Tracy also has a widowmaker, is that right?
She did, because it was the left main coronary artery that was involved in her case. It was actively dissecting. That was why she was having a massive heart attack right in front of us. And when that artery is compromised, the blood flow to the majority of the heart is compromised, and it can result in sudden death.
I know, Tracy, I understand that you thought you were going to die.
Yeah.
Tell me what happened there. So you're in the hospital and you were worried.
Yeah, I actually...
Understandably. My goodness.
I used to work at Providence St. Vincent in the ER as a crisis intervention specialist.
Wow.
So when they were wheeling me into trauma room 1, I knew that wasn't good.
Yeah.
And the ER doctor, actually I had worked with previously, great doctor. And I looked at her and I just said, Am I going to die? And she said, I'm going to do absolutely everything I can to make sure that does not happen. And a little bit later, it was the cardiac surgeon that they called in my case that saw on the imaging the tear. And she was the one who said, we're going to go ahead and do a double bypass.
Wow. Dr. Tam, what should we know about SCAD?
So SCAD is sometimes difficult to diagnose because the vast majority of the time it happens to young, healthy, active, younger women.
Wow.
And they don't have the typical risk factors that you would expect that they would have heart disease, right? There is a relationship with estrogen because we know that this is the most common type of heart attack that women have while they're pregnant or in the postpartum period. There's also an association of hormone replacement therapy and increased risk for SCAD heart attacks.
So what should we do to minimize our risk?
So I think for women who actually have known SCAD or a condition called fibromuscular dysplasia, which is a blood vessel condition that predisposes them to tears in the blood vessels and aneurysms, they really should be careful to avoid high-level estrogen-containing products such as hormone replacement therapy or even birth control pills. They should maintain good blood pressure control because high blood pressure will tear the blood vessels more and put more stress on the walls. And then lastly, to avoid really, really high-level intense physical exercise because that can also predispose the blood vessels to tears.
To avoid it?
Yeah. So this is not a typical blockage type of heart attack from cholesterol plaque and being overweight and diabetes and all that. It really is a weakening in the blood vessel wall that makes you susceptible. So in these patients, actually I've seen it in otherwise very healthy people who are very, very high level athletes because it predisposes them to tears.
Wow.
So it's not a typical type of heart attack.
Fascinating.
Yeah.
Tracy, I'm glad you're doing well.
Yeah.
That's awesome. Yeah. Congratulations. All right, we're going to have a link to Providence Heart Institute's Heart Month activities, that calendar they have on KA2.com. And for more information about how to keep your heart healthy, head to our Family Matters page, click on our Lifestyles tab, and then on the Family Matters icon. Thank you both very much. Appreciate it. All right.